Welcome back to Talk Jamaica here on Talk Jamaica Radio. We are streaming live on TalkJamaicaRadio.com. I'm Ralston Chamberlain and I'm joined by my co-host Sanjay Lewis. We're sitting in for Ricardo Brooks. It's now time for part two of our discussion segment. Many of us listeners will remember the unfortunate and brutal beating of a university student by security guards for allegedly being caught in a compromising situation with another male student at the University of Technology in 2012. It was seen by the whole world, and again Jamaica and its alleged homophobia became the talk of the water coolers. It could have become a very dirty and stubborn stain on the country's image and on the university's international reputation. Following the incident, there was quite a bit of talk about tolerance and respect and the need for basic understanding of diversity. Utech decided to move beyond talk and initiated a program to look at how it could strengthen respect and tolerance among its stakeholders through the just concluded Utech Cares project. To tell us a bit more about the project, we are joined by Dean of the College of Health Science at Utech, Dr. Ellen Grizzle. She was the lead researcher in the project. Dr. Grizzle, good afternoon and welcome.
Yeah, good afternoon to you and your listeners. I've just stepped away from an event, so I'm hoping that you're hearing me clearly.
Absolutely. Good. Let me ask you this, Dr. Grizzle. We know how the project came about, but tell us how it was initiated and what are the components of the project.
Okay, we looked at the situation and recognized that it had violent acts like the one that you described on the campus before. Mm-hmm. And in the context of what we saw was violence across the country, a flash of violence. Whenever there was an issue of disrespect or intolerance, we said, okay, the university would do the public relations piece, which it did, but we wanted to do a more deeper inquiry into exactly what were the causes for the violence. Mm-hmm. We understood the allegation that the students were alleged to be homosexual and caught in public homosexual act. We understood that. But we wanted to understand more the urgings of our community, Utech community, as to how they felt. I must tell your listeners that initially the whole university was in a state of horror. People did not understand what was happening on the inside. I'm saying no. There's a lot of horror on the inside of the university and the desire to have a response after the last day. So having looked at that, we decided that we need funding to do the qualitative work that would lead us to certain conclusions about how we should go forward in a behavior change response. So the components were first qualitative work in terms of focus groups to talk about the preferences and the perceptions of all of our internal stakeholders. And based on what we found, we developed what we call a behavior change communication response, the start of which, because, behavior change takes a very long time.
Mm-hmm. Mm-hmm. All right. Tell us, if you will, Dr. Grizzle, how did the USAID came on board with this project?
Well, they came on the second round after we'd done the first year in terms of the qualitative and had a strong sense of exactly how, in a sequential and coordinated way, we could set up a system to respond and to measure that system. They came on now with a one-year project in terms of helping us now to execute the components. And the components had to do with changing attitude, or changing the attitude to begin that process, to see if we could get the dialogue going among our stakeholders as to the way forward, and also number 3, how we could now have some lasting impact on the Utech community, so that after the year we could, in other words, we could continue the process. In other words, it would be institutionalized through policies and through programs and so on. So they funded us for that 1-year process to begin that process, because behavior change, as I said, does not take hold in a 1-year process. It just does not. That's not how it works. So we are at the end of the 1 year, and now we are able to report out some of the things that we have done. If you want to share those with you, I can. Right. For example, the first thing that we did was to have competitions among the young people in our university in terms of the logo, in terms of the poetry, in terms of the debating, and in terms of the drama and music and dance. That brought them into our students into the process by their creative expressions of what they thought about tolerance, what they thought about respect, they thought about sexuality. All of those things were among the things that were discussed. We had also competition for sculpture and mural, and the students did those two pieces that emerged as first, the faculty of the built environment. And those are now monuments that stand within the university and can be viewed by all. Then we had signage, both internal and external of the university, signs about some parts of Jamaican landscape, and as well in terms of the Utech itself. And then we had workshops that were very, very powerful, cathartic for some, who felt brought down in tears as they told stories of their own sexuality and their own response to the whole Utech Cares process.
Dr. Grizzle, I hear all of that, and what I would really like to know is what has been the reception now that from the university community and even also by the stakeholders?
Well, I am cautiously optimistic at the response that we've seen. I'm a scientist, so it's, I'm very cautious when it comes to saying what I can respond. I will tell you that in terms of the role, the use of the word tolerance, when we started, there's a lot of skepticism that it was a foreign-driven agenda that we were pursuing. And now, of course, that is somewhat tempered and mediated, where people understand that this is something that we developed at Utech and that we own it. So this idea that because you have an initiative to deal with, we thought mob violence, whatever its source, that somehow it's a human rights thing that comes from abroad. I think we have tempered that thinking, and the acknowledgement has been there through the Students' Union that became an ally with us in terms of that part of the process. I find that the management of the university too, when they said to us that we were to take the charge of this process and move forward, were more thinking public relations, as I explained. Now they recognize that it had to do with a deeper response. And so they have come on board in terms of our behavior change response. And that's a good thing for the foreseeable future because it needed to be at the top of consciousness in terms of the management stream going forward. Students and faculty and administrators were concerned about how we treated one another, the civility. And so people are now observing those kind of markers and, respect that we should show to one another. That was something that people want to see improved. And to some extent, we have seen that the policy issue, where you want to now institutionalize some of the behaviors in terms of anti-discrimination and so on. We are working on those policies now, so those will be there as a guideline, a marker for how the university will go forward in terms of its relationships among the stakeholders. So there are some things that have been accomplished that make me hopeful and make the manager of the project hopeful. And I said I am cautiously optimistic. There's more to be done. More is coming out of the project so that we will have a little more time to really see what is that we achieved. Professor Hamilton did present, who is one of the leaders of the project, did do a survey also that concretized some of the things that we felt qualitatively to say exactly where we were. And in terms of the survey monkey, we found that people were very receptive, they are very optimistic, and so on about what we have started at the University of Technology. And I think their external stakeholders are looking now to see what parts of our model, what parts of the thing we do can be exported to the wider Jamaican population, which of course would be an accolade for us as the University of Technology. So that should happen.
But tell us, if you will, of the College of Health Sciences at Utech. Now that this project has been launched and has gone forth, what would be the one takeaway lesson that Utech would have learned in terms of tolerance and respect?
In terms of approaching tolerance and respect, our findings were simply that our young people and students were the most persuadable group towards those acceptable behaviors. That is not out of bounds in terms of how the world records that the young people are the ones that are more open to certain social issues and so on. So that is something that we've learned. The second thing that we've learned, it is possible to have different perspectives and yet meld around certain issues that bind the universe together in terms of the lived experience of our values, respect, integrity, excellence. That people can kind of transcend it with personal hinderings that they have to come together around common cause. And that speaks, I think, to the fact that we are building a more mature set of stakeholders across our university. That augurs well for Utech. It also means that those of us who, although we have different orientations and preferences, still abhor violence. And around issues of violence, we can work together to bring others together around other issues. Nobody at Utech has claimed that they are changing their views towards, say, people of same-sex orientation. That is not the claim that we are making. But we are saying that despite of that, people can still work together. And that was what was kind of missing before the dialogue. It's there now. People are listening to one another around issues of same-sex orientation, around issues of violence, among issues of respect, among issues of civility, while not changing their personal conviction, if you understand what I'm saying. But we are able to work together in one university.
All right, Dr. Grizzle, for coming on this program and discussing with us Utech Care, and we look forward to hearing more about the project.
We are hoping for, first of all, the bottom line is no more barbaric behaviors before our university gate by our students.
Absolutely.
That's really where we, in terms of what we want to see coming out of this project. That behavior change that says it's not okay. It's not okay to do that. I think we have got there. I think in the sensibility of our university, I've got there. And I thank you for the opportunity. I'm sorry I can't stay with you as well longer. But maybe another time we can have a conversation about what we are going to do going forward, because there's a lot to come.
Absolutely. Thank you, Dr. Grizzle, for joining us.
All right. Bye.
Listeners, in case you are just joining us, we are talking to Dr. Ellen Grizzle, Dean of the College of Health Science at Utech, and talking to us about Utech Care.